Hello. Today we're going to be speaking about emergency department patients who present with dizziness and vertigo in an attempt to successfully diagnose serious central etiologies. This presentation is supported by FERNE, the Foundation for the Education and Research in Neurological Emergencies, FERNE.org. My name is Edward Sloan. I'm an emergency physician that has practiced for 35 years. So let's talk about our educational objectives related to this attempt to diagnose serious etiologies for dizziness and vertigo. Our first educational objective is to enhance the understanding of the definitions and pathophysiology of dizziness and vertigo. Second, we will attempt to understand what diagnoses are likely given the type of vertigo the dizzy patient describes. Third, we will gain knowledge as to how to diagnose central causes using the dizzy vertigo patient history and physical exam. Fourth, we will specify the exact history and physical exam findings that should be established and documented in the evaluation of ED patients with dizziness and vertigo, highlighting especially the HINTS Plus test and the standing test. Fifth and last, we will review relevant publications that explain the role of the history, physical exam, neuroimaging, and new technologies in patients with dizziness and vertigo. I have no financial conflicts. I have served as FERNE president and board chair for over 3 decades. I encourage you to go to the FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And please follow us on social media for more real-time information on the care of all patients with neurological illness, injury, and emergencies. If you have comments and questions, please get a hold of us at fern.org@gmail.com. Thank you very much and have a good day.